What's up, YouTube? It's your girl Queen, and I am alone by myself again, as you can tell. It's currently 5:22 in the morning. I decided to make a video early this morning. So I do a lot of videos on my own that I've noticed, so I should give it like a little name, like give this segment a name. And I was thinking about calling it Queen Talks. So I think that's what I'm gonna go with. So I was in bed watching TV because I work night shift now, so I was just like, hey, let's film a video. So I decided to let you guys in on how I went from a public health nurse back to a hospital working nurse. Totally different. But yeah, if you want to know how that goes, stay tuned. So if any of you guys have watched my previous video, the public health nurse video, and I'll link it up below in the cards. If you guys watched that, you guys know that I recently moved, and I kind of didn't want to do public health nursing anymore. I wanted to take a different route, make more money, do something different. So when we moved down here, I was offered a job at I would never go back to acute care, hopefully, but at a rehab hospital. Not drug rehab, not any of that type of stuff, but more of a rehabilitation place where people with strokes come, people who, what else kind of stuff? Hip replacements, knee issues, people with external fixators, help them learn how to walk. In order to be at this hospital, you have to have 3 hours of therapy. So we have a bunch of physical therapists, 3 hours of therapy a day, I think. I don't know all the gist of it yet. It was actually kind of hard, and it still is kind of hard. A lot of people say if you become a public health nurse, you lose your skills, and it will be hard for you to go back to hospital settings, which I can agree and I can disagree. Once you've learned your skills, they never really go away. You may have to like bring them back out, but they're never really fully gone. So for me, during my interview process, I let them know my situation, and when I was in the hospital setting, I only worked 3 months in the hospital setting before I left and went to the health department. So I was fairly still new anyway, but I did a lot in that 3-month span before I left. And so I remembered some of the skills or whatever, but when I got there, I let them know, hey, I only had this much time in a hospital setting, then I moved into a public health setting, blah, blah, blah. So basically, she set me up with a longer orientation process. Not as long as a new grad nurse would get, but just enough for someone who has some experience in a hospital setting. So I'm still currently on orientation, and I think it will be up in May. But anyway, the process, it takes some getting used to. It's kind of like you need refreshers on everything, if that makes sense. Basically, like the other night, I had to do a Foley on someone. I haven't did a Foley since freaking, when was that? Maybe June or July of 2017. So of course I'm like, okay, I need a refresher. So my preceptor, she of course did it for me the first time, let me see, and then it just came back just like that. It was like, oh, I could have did this. So it's like you think you don't remember until you're in that situation, and then you remember. You're like, oh, duh, you know what I'm saying? As far as like, let's see, medications, I got an app on my phone to help refresh me on that. But we have this awesome system where if you don't remember a drug or don't actually even remember how to pronounce it or anything like that. This you click it and it says reference manual in our computer system at the hospital, and it'll tell you everything you need to know about the drug right there. So that's awesome. But I pretty much remember a lot of the drugs, and at this place is pretty much a lot of the same drugs. A lot of pain medicine goes on, but the people at this hospital, they do have medical conditions. That's how they qualify to be there. So they have to need 24-hour nursing care in order to be eligible to work at this hospital. So it's not like these people are in good health and I'm just taking care of somebody who had a elective knee surgery or an elective hip surgery. We have people, motor vehicle accidents, all kind of stuff. It's a whole bunch of stuff. So you still need to know your skills. It's not an acute care, but it's still a hospital setting, so you still got to be on your stuff. So I was nervous, let's say that, and I still get nervous sometimes because sometimes it makes you feel like you're inadequate to the other nurses or you're not up to par like them, because although I've been a nurse for 2 years now, sometimes it doesn't feel like it. Sometimes it feels like I'm still a new grad nurse because I went to the public health setting for so long. I did a year and a couple months there. So that's a whole different ballpark of nursing. That's a whole different type of nursing. Like, it is nowhere near, shape, or form anything like hospital nursing. So it's kind of hard and you feel inadequate and you feel like, will I make it? Will I get through this? To be honest. But every day gets easier, but the transition, like I said, it's hard and it's not. Some stuff you never forget. Some stuff you will never forget, and some stuff you will, and you need refreshers because you didn't use it every day. But luckily at the health department we did a lot of blood draws, so that helps when I need to do an IV. Little stuff like that. Like, you don't lose every skill, but you do lose a lot of skills. I remember when I first decided to go into public health, I was nervous that a lot of people were going to be like, oh my God, she wants to be working in the health department. She ain't going to know what she's doing, blah, blah, blah. She's going to lose all her skills, blah, blah, blah. But I don't know. You can't really worry about what other people think. You got to do what your calling is. And I felt like at that time, I needed to be there at the health department, but now I'm back in the hospital setting and I actually really enjoy it as of now. I have my days where I'm like, oh my God, what did I get myself into? But then I have other days that are just good. It's awesome. It's like I feel like I'm back in the swing of things, but it does take some getting used to again. And I think being that I only did 3 months in a hospital setting to begin with, I kind of am new to the hospital side of it still, but I don't know, it's hard to explain because it's just so different, you guys. It's so different. And then being that I'm in a rehab hospital, that makes it totally different from an acute care hospital anyway. Like, we don't, if someone gets really sick or really bad off, they sign papers there and we send them off to another hospital, an acute care hospital. So it's like, I don't know, it's totally different, y'all. But I love it. I think I can see myself being there for a while, hopefully. And you guys know I'll switch a job in a heartbeat. But anyway, it's really good. I like it so far. I'm getting all my skills refreshed because that's all you can do because you're using them. But I don't know. I just decided to record this video. It's really short and sweet and to the point. If you guys have any questions or anything you guys want me to answer specifically, because I did not come prepared for this video, it's just off the top, you guys let me know down below in the comments and I will make a video to answer your questions. So yeah, be sure to like, comment, and subscribe, and be sure to click the bell icon so you guys won't ever miss another video. And that's it. That's a wrap on the Queen Talk.
Riding good, smoking good, sipping good.